Hey guys!
Hey guys.
Hey guys.
Hello everyone! Today we're going to be presenting on injectable hydrogels for joint wound healing. Okay, let's get started. My name is Estelle and I'll be presenting on the background and aim for our article. So the problem. Skin damage is one of the most common physical injuries throughout history. Wounds and scrapes on extremities or on joints make up a majority of skin trauma. Traditional wound dressings include gauze and bandages, and they are typically dry and used for protecting the wound against contamination. These options allow for dehydration and do not promote healing, rather they just serve to cover the wound. In addition, traditional dressings face considerable problems in joint wounds, in areas like the ankle, knee, and wrist. Due to the frequent bending and motion in these areas, patients experience dramatic increases in their discomfort. Meanwhile, the reliability and effectiveness of the dressings decreases substantially. For those reasons, designing a wound dressing that has outstanding therapeutic effects, is self-healing, adhesive, and has suitable mechanical properties is of great practical significance to healthcare, particularly around joint healing. Current advances. Modern wound dressings that address these problems are normally based on synthetic polymers, and one area that has seen a significant amount of innovation is in the use of hydrogels. Hydrogels have been explored in various studies for one or more of the following advantages. The hydrogel matrix itself can allow for oxygen to penetrate that maintains a moist healing environment, and this is due to its porous structure and suitable swelling ratio. Hydrogel adhesives can inhibit the growth of bacteria. Antibiotics themselves can be encapsulated within the hydrogel matrix. Bioactive molecules can be encapsulated with healing drugs that can be loaded into the hydrogel dressings. And finally, hydrogels have a moderate stretching and compressive capacity, meaning that they can tolerate the mechanical deformation caused by movements in the joints. So now the aim of this study. Until now, a kind of novel wound dressing, specifically related to joint skin wound care, hasn't been reported, particularly one that combines all of the advantages listed above. This study reports the properties of a series of versatile injectable hydrogels. Each was tested for its self-healing properties, adhesiveness, stretchability, homeostasis, pH responsiveness, and its inherent antibacterial properties. Each hydrogel was then evaluated for its use as a novel joint skin wound dressing, as compared to the current standard of commercial bandage dressings.
Hi everyone, my name is Zachariah and I'll be presenting on the method section of this presentation. Preparation of hydrogels. Quaternized chitosan was synthesized by conjugating GTMAC to the amine group of the mer unit on the chitosan background. The hydrogels were then prepared by mixing a QCS solution and a PF127 CHO solution using various aldehyde and amine ratios. The PF127 CHO solution was used as a cross-linker. To test for the self-healing performance of the hydrogels, two tests were conducted: the macroscopic self-healing experiment and the quantitative self-healing test. To test the macroscopic self-healing properties of the hydrogels, two experiments were conducted. For the first experiment, 4 hydrogel discs were prepared. The 4 hydrogel discs were stacked on top of one another and placed in the humidor. For the second experiment, 2 different colored hydrogel discs were cut into tiny pieces and blended together. The mixture was placed into a cylindrical mold for 2 hours, after which the hydrogels from both experiments were observed. For the in vitro study, the hydrogels were loaded with curcumin, were placed into PBS solutions with varying levels of pH and shaked at 100 rpm. At specific time intervals, 1 milliliter of the mixture solution was withdrawn to test for the release concentration of the drug. In vivo wound healing experiments were carried out in female kunming mice with a 1 cm diameter full thickness skin round wounds created by needle biopsy. The mice were divided into 3 groups: control group using the Tegaderm film, the normal hydrogel group, and the curcumin-loaded hydrogel group. Every 5 days, the wound area tissues were collected for analysis, and the wound area was measured by tracing the wound boundaries on plotting papers. Wound contraction was calculated using the formula below. Antibacterial activity evaluation. E. coli and S. aureus were used to test the hydrogel surface for its antibacterial activity. Tests were repeated 3 times for both control and treatment groups. The kill ratios of bacteria by the hydrogels were measured by the following equation. Mechanical properties of the hydrogel. To test the mechanical properties of the hydrogel, the tensile test of the hydrogel was conducted using an instron at a cross-hit rate of 5 mm per minute. The compressive test of the hydrogel was carried out using a rheometer with a speed of 6 mm per minute at 60% strain and then recovered to 0% strain with a speed of 6 mm per minute. This cycle was repeated for 20 times to determine the compressive and recovery properties. Both tensile and compressive tests were conducted more than 5 times. Histological analysis. To evaluate epidermal regeneration and inflammation in the wound area, samples were collected every 5 days. They were fixed with paraformaldehyde, embedded in paraffin, and then stained with hematoxylin eosin. The regenerated skins from the wound site were also excised at 5-day intervals for immunofluorescence staining.
Hi, my name is Kevin and I'll be taking over for the results portion. Here, the chemical composition of newly synthesized QCS-PF hydrogel was confirmed using 2 methods. In FTIR, this peak comes from PF and this peak comes from QCS, so it means it has attributes of both. In the TGA graph, it's not quite either QCS or PF, so it's a mixture of both. Experimental results showed that the tensile strain or stretchability of these hydrogels are suitable for joint bending. The hydrogels range from 58 to 76%, while native skin has around 60 to 75%, which is perfect. After testing tensile strain, the hydrogel was then tested for compression strain. One of the tests involves comparing plastic deformation and strength at different loading cycles. While these differences were great at 90% as expected, at 60% strain, the hydrogel remained stable and easily maintained its structure after 50 loading cycles. Due to these mechanical properties, when the hydrogel was applied on the elbow, the experimenter could freely bend their elbow from 0 to 180 degrees without any resistance, which verified its practical use as a joint skin wounds dressing. Here, the hydrogel demonstrates its ability to self-heal. These pieces that were blended together and placed in mold for 2 hours at room temperature healed back together with no boundaries along different hydrogel pieces. In G, a piece was cut into 2, and in H, about 3 seconds later, the hydrogel was healed almost immediately, enough to hold itself against gravity. When placed in a syringe and expelled through a needle, the hydrogel can maintain itself as one piece. Combined with the self-healing capabilities, it can easily be seen that it has potential to be injected into a site for molding and healing into the wound shape. Then the material was tested for antibacterial properties against E. coli, a gram-negative bacteria, and S. aureus, a gram-positive bacteria. This antibacterial property comes from the positively charged amino groups and quaternary ammonium groups from QCS, which damage the walls of bacteria, which then release their intracellular fluids. It makes sense then that increasing the QCS to PF ratio increases antibacterial properties. Curcumin has anti-inflammatory, anti-infectious, and antioxidant activity. It's also been found to enhance the migration of fibroblasts, which are cells that synthesize the extracellular matrix and collagen, produce the structural framework for animal tissues, and play a critical role in wound healing. It's because of these effects that this drug was chosen to be encapsulated. So we're worried about pH here because the majority of wounds, including acute wounds, wounds with pus or necrotic tissue, and chronic wounds that progress in their healing process, show an acidic pH. Here are graphs showing the effective pH on the release of curcumin from hydrogels with differing QCS-PF ratios, which is critical information needed for controlling dosage and understanding the time frame during which curcumin is released. The acidic environment more readily degrades the QCS portion of the hydrogel, so the ratio of QCS to PF can be used to control the duration and amount of release. Now we're moving on to in vivo testing to demonstrate the practical use of these synthesized hydrogels compared to commercially available competitors. QCS-PF consistently outperforms commercially available film, even on the 15th day, which on the surface appears to be about the same. This can be attributed to the effects of the inherent antibacterial performance of QCS, chitosan's function and promotion of wound healing, and the moist wound environment provided by hydrogel dressing. QCS-PF showed the best effect during overall wound healing stages since curcumin helps with inflammation, proliferation, and remodeling, as well as the other effects mentioned previously. Here's a comparison of histological analyses between groups. The blood vessels are yellow arrows, hair follicles are green arrows, the boundary of epithelium and dermis is shown as blue lines, and the completed epithelium is shown as a yellow hexagram. As shown, Cure QCS-PF has the best recovery of necessary functional elements of skin over a 15-day recovery period, as well as the best recovery of tissue thickness.
Hey guys, this is Rachel. Ultimately, this study achieved a product that is both novel yet extremely feasible by expanding on existing products in the market through not only improved properties, but also new features. In fact, the study showed that this new hydrogel formation gave faster wound healing rates with lessened inflammatory reactions, greater granulation tissue thickness, and a higher density of fibroblasts and collagen than existing commercial wound dressing products, such as Tegaderm. Current dressing materials are unsuitable for the constant mechanical movement, such as bending and twisting, that are experienced at joint wounds. However, this injectable hydrogel wound dressing's new properties, such as built-in antibacterial characteristics, as well as a self-healing, stretchable, and compressive property, proves an effective joint wound dressing that is lacking in the current market. As a hydrogel, this product suffers from general hydrogel limitations, like low mechanical strength, relative difficulty to handle, and difficulty to sterilize. However, the inherent antibacterial property should combat any complications with sterilization. Although not included in the article, one factor to consider is how this particular hydrogel impacts the area surrounding the wound, given that each hydrogel cannot always be cut to the exact size of the wound. For example, surrounding tissue could undergo maceration if in contact with the gel moisture for too long. Lastly, while the material chosen for this hydrogel, chitosan, has various properties that solve general hydrogel issues, such as its benign gelation conditions and antimicrobial ability, this material does have its drawbacks. Chitosan has limited solubility in water and other organic solvents, so this hydrogel is limited in further applications outside of wound dressings. While the study did a great job of outlining the improvements of this hydrogel compared to existing competitors, researchers can begin thinking about both drug delivery methods and the treatment markets to which the hydrogel can be applied. For example, will this hydrogel only treat skin wounds, or can this hydrogel also penetrate deeper to treat other joint issues such as arthritis? Is there an open market to treat other round surfaces such as the butt for bed sores or pressure ulcers, or diabetic wound ulcers on the feet? Given these treatment markets, researchers should consider the easiest drug delivery methods for regular consumers, ranging from children who fall down on the playground to the elderly looking to treat their joint pain. Lastly, the researchers can think about other factors in marketing to compete with existing hydrogel wound treatments, such as affordability. Researchers must consider if consumers will believe these novel properties to be large enough of an improvement to warrant an increase in price. If not, then the consumers may buy an existing product despite longer, slightly more painful recovery times. And that concludes our presentation. Here is our works cited, and thank you all so much for listening.